just want to apologize. It's a little bit of a different setting tonight. I just have to hold this class because the class has been scheduled, and it won't really be okay if we can't have this class. So that's why we are doing this tonight. So sorry, it has to be this way, not the usual way we do our things, but nevertheless, here we are. We just have to proceed. Okay, so today we are taking the course ENT ECE123, and the course code is early childhood, healthcare in early childhood. So we have that as that, if I'm not mistaken. So it's a revision. So it's going to be more of I think others are yet to join. Hopefully they will join as the class commences. So I'm just going to read out the questions, and it's going to be more like a discussion and interaction, and we can just proceed. So we have the very first question here. We have good health and general well-being of women of reproductive age is a pillar for having and raising healthy children in a nation. Now, the pillar for having and raising healthy children in a nation is tied to good health and general well-being of women. So we have question 2. We have number 2. Now, ancient Greeks says a healthy and a strong woman has the tendency to give birth to a strong and healthy child. It's only, according to the ancient Greek, it is only a strong woman that has a tendency, a strong and healthy woman that has a tendency to give birth to a strong and healthy child. So we have number 3 now, Colander, Ballard, and Chandler. Colander, Ballard, and Chandler, 1999, noted that the health of the world, a country, or a community rests on the health and well-being of its women, as well as that of children, and not only on its men. So the keywords here are the wealth, the well-being, the health, and the well-being of a country, community, the world rest upon the shoulder of its women, children, and not only its men. So we have the role of a woman in the promotion and maintenance of health of a child cannot be overemphasized. So we have also pregnancy occurs when sperm attached to an egg within 24 hours. Pregnancy occurs when sperm attached to an egg within 24 hours. So we have in the fallopian tube, the fertilized egg divides and grow and move towards the womb gradually within 5 days. So we have another key point here which says nourishing diet is very essential throughout pregnancy so as to have essential nutrients. Nourishing diet is very essential throughout pregnancy to have essential nutrients. So also have adequate nutrition is important for tissue, bone, organ development, and neurological development of fetus. Adequate nutrition is important for tissue, bone, organ development, and neurological development of fetus. Now, this is still the course ECE 123, early childhood, EC, ECE 123. So we have that as that. Then we may proceed. So we have water helps in regulating body temperature and in food digestion. Water helps in regulating body temperature and in food digestion. So we have as well fertile, fertile growth and development during pregnancy. We have first 0 to 14 weeks. We have second 14 to 28 weeks. We have third 28 to 40 weeks. Then we have pregnancy test as soon as the woman's period is missing for confirmation. Now we have talk with your partner or someone else you trust, being antenatal care, and check up with the medical provider. As soon as a woman's period is missing for confirmation, talk with your partner or someone else you trust, begin antenatal care, check ups with the medical provider. So we have antenatal care is health care and education towards good health and safe delivery given to pregnant women. Antenatal care is health care and education towards good health and safe delivery given to pregnant women. Okay, we have that as that. Now we have during pregnancy, another living being is growing inside the woman. During pregnancy, it is said that another living being is growing inside the woman. Okay, we have somebody with us now. Please do well to mention your name and your department. Okay, so we have that as that. It's a little bit different from what we usually do tonight, but we just have to hold the class. So that's just it. So let's just be with me tonight. I have to rush somewhere and I can't make it back home before the class commences. So that's why we are doing it this method. So we have pregnancy. During pregnancy, it is said that another living being is growing inside the woman. Now we have stillbirth is referred to a situation in which a child is born already dead. Stillbirth refers to a situation in which a child is born already dead, which might have occurred few days or weeks in the uterus before birth. Stillbirths refer to the situation in which a child is born already dead, which might have occurred few days or few weeks in the uterus before birth. So we have labor is the period in which the process of child delivery starts. Labor is the process in which child delivery starts. The process in which child delivery starts. So we have um, now labor begins with opening and dilation of the cervix and ends with delivery of the placenta. Begins with the opening, labor begin with the opening and dilation of the cervix and ends with delivery of the placenta. Now we have three stages of labor. Three stages of labor. First, womb, neck starts opening with frequent contraction downward, pushing down to the baby towards birth canal, all lasting 5 to 18 hours. Wow, that is much. Second stage, sufficient opening of the neck of cervix. Cervix here means womb. Sufficient opening of the neck of the womb, permitting the delivery of the baby last about an hour. Third stage, sequel to the delivery is coming out of the placenta that may last up to 30 minutes. Okay, family planning plays a vital role in the lives of women of productive age. Family planning plays a vital role in the lives of women of productive age. Family planning refers to those attempts made by couples to control their fertility to be able to have number of children they wanted. So we have the contraceptives and the device used to prevent pregnancy. Contraceptive and devices used to preventing pregnancy. So we have infertility is a disease of the productive. Infertility is a disease of the productive. Now we have infertility says the failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. Failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse is what we refer to as infertility. Now, infertility in either the man or the woman constitutes a serious problem. Infertility in either the man or the woman constitutes serious problem. So we have we have fertility is what every family prays for because it is the sign of fruitfulness in every marriage. It is a sign of fruitfulness in every marriage. Infertility is of two types. We have primarily primary infertility, which is referred to as the inability of the woman to get pregnant despite frequent unprotected sexual intercourse and she's willing to become pregnant. Secondary infertility refers to the situation whereby the woman has become pregnant at least once before she is unable to become pregnant now and anymore despite frequent unprotected sexual intercourse. So this is infertility in two ways, primary and secondary. Primary is that she can't even conceive at all, but secondary she has conceived a certain time, but she can't conceive anymore. As a second infertility. So we have that as that. So let's move on. We have what we refer to as STDs. STDs is an acronym for sexual transmitted diseases. We have IVF. IVF is an abbreviation for in vitro fertilization. In vitro, VITRO, fertilization. We have NGOs, an acronym for non-governmental organization. So we have nutritional deficiency constitute the major source of many threats to the childhood healthy growth and development. Excuse me. Nutritional deficiency constitute the major source of many threats to the childhood healthy growth and development. So we have nutrition plays a vital role in the life of every child. Children in their early years need proper and adequate nutrition for healthy growth and development. Children in their early age require proper and adequate nutrition for growth and healthy living, growth and development. Now, malnutrition causes severe stunning in school children. Malnutrition causes severe stunning in school children. Now we have nutrition contributes greatly in determining the health of an individual. Nutrition contributes nutrition contribute greatly in determining the health of an individual. So we have hereditary slash biological factors. Now it is the major factor that determines influences the health of an individual. Biological factors are the major factor that determines and or influences the health of an individual. So we have social economic status of the parents. This has to do with the income of the family. So we have parental care, which means the degree of concern with parents which parents show to children. Their child. Okay, children. Now we have physical fitness, deals with one's ability to perform a given physical work. And we have children easily develop postural problems such as kyphosis, ludosis, and scoliosis. Children easily develop postural problems such as kyphosis, lordosis, and scoliosis. So we have in early childhood period, the brain develops slowly and steadily. In early childhood period, the brain develops slowly and steadily. So we have bedwetting. This is said to be most children at night in their early years urinate on bed. That's what's called bedwetting. At night, most children in their early year urinate on bed. So we have philosophical questions. Now, there are questions which adults sometimes find it extremely difficult to provide right answer to. Those are philosophical questions. Now, school health service constitute one of the components of school health program. School health school health program, appraise, project, maintain, and promote health of the peoples, according to Dawn in 1999. Now we have immunization. Immunization is the procedure taken by schools to prevent pupils from being affected by certain health problems. Prevention taken by school, you know, to prevent procedures taken by school to prevent pupils from being affected by certain health problems. So we have that as that, and we have okay, I believe okay, so we have here curative measures. Curative measures are those procedures that are taken to help an individual overcome or recover from ill health. So we have anthropometric measure. Anthropometric measure is a screening test of a child's healthy growth and development. A screening test, anthropometric measure. Anthropometric measurement is a screening test of a child's health and growth development. Now we have nutritionists. Nutritionists serve as consultants who plan eating programs. Okay, Mr. Levy, these classes are for actually people in early childhood department, people in early childhood department. Yes, it's for them. I'm not sure. It's not your class. Okay, so we have nutritionists serve as consultants consultants who plan eating programs which are geared towards the needs of individual students. Yes. So we have physical therapists. Physical therapists are concerned with the rehabilitation of the function of the injured part of the body. That is physical therapists. Physical therapists are concerned with the rehabilitation of the functions of the injured parts of the body. So we have podiatrists. Podiatrists help in the study and care of the foot. Podiatrists help in the study and the care of foot. So we have pediatrists. Pediatrists are concerned with the practice of caring for or treating injuries and illnesses that occur in the young physical active children and adolescents. Okay, so just like as I said earlier on, when this class started, I needed to apologize the fact that it's a bit different setting today. The class was actually scheduled for 9, but there came an emergency and I have to rush to somewhere. And here I am now, just in order for me to hold the class and not to disappoint. We just have to do it this way. Usually there's usually a board behind and there's usually writing and everything is done that way, and it's usually most time an interactive class, unlike what I'm doing now. So let's just take this like this tonight. I believe majority of the people in this class, I sent them a key point because they actually reached out to me and I sent them the key points just for, I think this is their last paper. Subsequently in the second semester, it will be better off. So we have um, orthopedists, and orthopedists are responsible for treating injuries and disorders of the musculoskeletal system. Musculoskeletal system. That is an orthopedist. Actually, they are very particular with the bone musculoskeletal system. So we have okay. So we have a neurologist. Neurologists are concerned with treatment of the disorder of an injury of the nervous system. Injury of the nervous system is what neurologists are concerned about. So we have that as that. We have internists. Internists are physicians who specialize in the practice of internal medicine. Physicians who specialize in the practice of internal medicine. So we have OPA, ophthalmologist. Ophthalmologist, we have them as those physicians who manage and treat injuries to the eye. They evaluate and fit patients with glasses or contact lenses. That's ophthalmologists. So we have psychiatrists. Psychiatrists are responsible for diagnosis, treatment, and prevention of mental illness. And we have child abuse. This is referred to as the violation of any child rights. So we have what we call MDGs, that's Millennium Development Goals. And we have WHO, which means World Health Organization. And we have FAO, meaning Food and Agricultural Organization. And we have United Nations International Children Emergency Fund. United Nations International Children's Emergency Fund, which is UNICEF. All right, it's a very short class tonight. I think some of us came a bit late and the class has begun, but nevertheless, you can always come back to the class and listen to it in your convenient time. Thank you very much, everyone. This is your last paper for the semester. I wish you all success and good grades, and may the Lord crown your efforts with success. Thank you very much, and I look forward to seeing you in subsequent tutorials. Bye.